Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Lharissa Jacobs with the American Heart Association. And good morning.
Good morning, Kim. Thank you so much for having me and the American Heart Association on your show. We really appreciate it.
Well, we're celebrating heart health in this month, so we want to make sure that our listeners get a lot of good information, and so we can kind of get the ball rolling. And so we're going to be talking about getting to the heart of your health. That's our title for today. And so let's talk about, for our listeners, some best practices for heart health, and then while we're doing that, how about if there's topics that seniors need to be mindful of?
Yes, well, thank you so much. This is probably one of my personal favorite topics. I am deeply living, and that's such a building block for all of us as we age and our health. And so I always say it's two sides of the coin. There's healthy eating. We really need to be mindful as we look at our plates that they're colorful and full of fruits and vegetables. And then the other side of the coin, of course, is movement. And so really lifestyle movement, making sure you get those steps in. We don't need to necessarily run a marathon, but if that's your thing, we certainly have some amazing models, role models out there that are active as they age. But I think just natural activity, physical activity, and the Centers for Disease Control, CDC, recommends 150 minutes per week of physical activity. That could just be walking.
Yeah, walking always made me feel better. Then I moved to the country and there's less good places to walk. So it makes it a little more difficult. So I walk around the office a lot, if that helps.
Oh, good for you. That is actually an excellent idea. Walking meetings are a fantastic idea. So
well, I can't say that I can have a meeting and walk, but I do pace. And so it helps a little bit, to get some of those steps in. And so
and get your brain going.
Oh, absolutely. I do a lot of my best thinking walking sometimes too. So that's helpful.
I love hearing that.
Yeah. Well, it's strange how good ideas come to you, and sometimes they're walking, sometimes it's weird times, and so you just never know, but you always want to be prepared when one does occur. So
100%.
So let's talk about movement. We talk about walking, but what other things can seniors do as they age to keep going, so maybe they don't walk as well? What are other things that maybe they can do to still stay heart healthy during this process or as they age?
Well, that's a great question. I think one thing to consider is the holistic relationship between our minds, our emotions, our mental well-being, physically, how much exposure we get to beautiful outdoors and nature, excuse me, and social interaction, as well as healthy behaviors. So, again, your level of vigorous activity is a really kind of a personal thing. Walking is great. If you can't get out there and walk, there are so many things that you can do, even just sitting in a chair. I know a lot of us have had orthopedic issues, and sometimes even chair exercise is a great opportunity for us to try some resistance training, light weights, and then just touching back on social isolation and making sure that perhaps you have social connections in your life, because again, if you are mentally well and happy, your heart and your brain tend to fare better. So there's a lot of research on that. Even if you go to the internet and you Google American Heart Association or circulation articles, there are so many articles, and even on our website at heart.org, you'll find so much information about just how to move and how to live in a way that's healthy, that will protect your brain and your heart.
Yeah, that's good. And, it's nice that there's so much information that the American Heart Association puts on their website, so you can go and find it. So definitely encourage our listeners to do a search for the things that can help them the most. So we talked earlier, I think, about the mind, heart, body connection, and so let's talk about mental considerations when you're thinking about seniors and heart health. How does that go, kind of hand in hand?
Well, as we age, of course, our risk for chronic disease will heighten and increase. And so, again, just thinking about the two sides of the coin, eat healthy, make sure you're getting a wide variety of fruits and vegetables. I know when we think about nutrition and we think about Alzheimer's and dementia, and certainly many of us have those risk factors in our own family history. It's so important to eat a healthy diet and really focus a lot on that colorful plate. There's a lot of information again on our website about Life's Essential 8. So you will definitely find healthy eating on our American Heart Association Life's Essential 8 tips and tricks. But I think going back to nutrition, it is very important that you take a look at getting your water, eating well. Also, I know that there are a lot of resources out there on dementia and cognitive decline and how to prevent. It's very important that the healthy lifestyle aspect for all of us kind of takes place as early as possible in our life. Where I'm going with this is that you may live long, and that is always the goal, is to increase life expectancy. But we want to live well, not just live longer. We want to live well. So some of us sometimes can live long, but we're having other things like chronic disease. And so you want to prevent and manage that. If you do happen to have type 2 diabetes or high blood pressure, which we call hypertension, again, there are ways that you can manage that and have a long and healthy life. So there's so much information out there. But if you're not being active today and you think, I've missed the mark because I was told I need to be active and live healthy as early as possible in my life, and now I'm in my 60s and I've waited too long. Not true. Get up and move today. Take a look at your plate. Make sure you're drinking water, but start now. When is the best time to plant a tree? It's right now. So plant that tree for your health and do it today.
And so, well, that's good advice. And so, because I know that some people think that, if they didn't do it earlier, it's too late now, and we talk to our clients a lot about quality of life, how, because that's important, and so you want to make sure that people are having fun, they're doing the things they enjoy, they're, that life is good, so however that looks, for seniors. So being able to, to enjoy life and be healthy is always a win-win.
Indeed. And sometimes it's just those daily activities that help us to live our best life. So if you take a look at your plate and you think, well, I don't eat vegetables, maybe just start with small steps today toward a healthier heart. And if you think, well, I really don't spend time with people every day, well, maybe pick up the phone, set up that daily check-in, daily phone call. If you are faring well emotionally, your heart is likely to also fare better.
So it seems like that as we age, we seem to have more, seem to be spending more time at the doctor. And so if we're not talking with our doctor about, heart, brain health, what should we be asking? And what sort of screenings should we be doing or encouraging someone to do as they start to age?
That's a great question. I'm going to my eyeballs will just take a look at my checklist here for just a second. But, it's very important that you do go to the doctor and maybe bring a piece of paper and a pen, because sometimes that information, when you're getting screened for your blood glucose and checking your blood pressure, that information is coming at us at a very fast rate. I know there are trackers and worksheets available online, just so that when your doctor talks to you, you can capture that information, because it sometimes is all Greek, right? It's all Greek to me, and I don't remember what was just said, because maybe you have white coat syndrome and you're a bit nervous in the moment. But you do need to advocate for yourself and make sure before you leave the doctor's office that you understand what was said. checking blood pressure, checking your A1C. I know that this, I'll be mindful when I say this, that sometimes extra tests cost extra money. So I would know what you're testing before you go in. So there's no surprise billing, right? But it can be beneficial to check your vitamin panels. It can't hurt to know, because as we age, there is some evidence that we sometimes are at risk for vitamin D deficiency, which can greatly throw off the system. So it's very important to your heart health. So I would just say, kind of know what you're paying for before you go in. Go in with a piece of paper or a form or in a pencil, and just make sure you know what you've been told before you leave the office. So much of our health happens before we get to the office. By the time we get there, oftentimes our cholesterol or blood pressure, our A1C or blood glucose levels have gone up, and maybe we didn't know it. So most of the work in maintaining healthy lifestyle can happen outside of the doctor's visit. But once you get there, you need to kind of be able to know what you're looking at. And if you have the means, I would say comprehensive testing, and make sure that you don't have any deficiencies.
So one of the things that we found in my family was that we would, when my mom goes to the doctor, my sister has her put her on speakerphone, so when the doctor comes in to talk to her, there's someone else listening. I love my mom to pieces, but she hears good news and kind of tunes out everything else. And so,
Fantastic
yeah.
advice.
Yeah, so that way, if my sister has questions that mom didn't think to ask, she asked them, and that has really worked well, so mom's pretty healthy, but still it's really worked well, so that, because I always think that, you hear something, but we don't hear everything, so because there's lots of information coming. So having someone else either with you or on the phone or something, so that way there's two people getting information, I think is always better than just one. And so
that's brilliant advice. We have a national initiative with the American Medical Association called Target BP, and it's all about blood pressure. And the phrase that they use that reminds me of what you're talking about is partnering with the patient. In this case, from the AMA and the AHA working together, partnering with the patient is really the doctor or the clinician partnering with the patient. In this case, the caretaker or the family member who just cares and loves their relative is partnering with their relative. So it's a partnership. It's really not you telling your parent what to do or vice versa. It's really a partnership. And so I love what you just said. It makes a lot of sense.
so it just makes it just helps, so that way we know information, so because if my mom got bad news, she might not come home and tell anybody. And so
Sometimes you're not honest in the doctor's office. There's a lot of evidence that shows that that some people, for example, I know elite runners sometimes don't want to talk about how many miles they're doing in the doctor's office, and it's a well-known fact that sometimes people will withhold, and you really do need to just trust the process and say what needs to be said, and then you'll get that great treatment and get good informed care.
there you go.
Yeah.
So any last things that you think our listeners need to know?
Well, first of all, we are very grateful for the chance to share our knowledge, our science-based knowledge, and the mission of the American Heart Association on your show. And really, if you want to get to the heart of your health, I recommend going to heart.org and check out Life's Essential 8. I didn't talk a lot about this, but we used to have Life's Simple 7. And what I didn't mention is with Life's Essential 8, we have overhauled the previous Life Simple 7 and added sleep.
Yes.
Which we could have a whole show on sleep, but we won't do that today. But I would say take a look at Life's Essential 8 and try to live by that and have a long and heart healthy life.
Perfect. And so I just want to thank you so much for being on the show, because it's always good information for our listeners and me. And so, and hope you have a great day.
Thank you so much.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.